Good afternoon, dear colleagues. Peculiarities of the organism of a newborn child is the topic for our discussion today. According to classification of childhood periods, newborn period begins with the moment of separation of the child from the mother and lasts 3-4 weeks. The Apgar scale has been used since 1952 to objectively assess the condition of the newborn child. As can be seen from the table, the Apgar scale uses simple features that are easy to assess. Doctor evaluates such signs as skin color, heart rate, reflex excitability, muscle tone, breath. Normally, if the sign is well expressed, it receives 2 points. In case of violation, the sign is estimated at 1 point. If there is no sign, it means 0 points. To evaluate newborn states according to Apgar scale, a sum of points calculated for each criterion of the scale should be found out. If sum of points makes 8, 10, a child's state is considered to be satisfactory. 6, 7 points, mild hypoxia is detected. 4, 5 points, moderate hypoxia or blue asphyxia is detected. From 1 to 3 points, child's state is described like severe hypoxia or mild asphyxia, and 0 points testify to a clinical death. First breastfeeding, which carried out immediately after birth, is very important for newborn's health. It takes only few minutes, but mitigate hunger stress, decrease postpartum stress, colonization of the child's intestine with the beneficial microorganisms, and also it's an important part of immune protection of the baby. Immediately after birth, the newborn begins to adapt to new living conditions. Physiological and borderline conditions are characteristic of newborns. Physiological conditions determine the features of the adaptation of the child to the environment in the first days of his life. Physiological conditions of the newborns are physiological erythema and peeling, jaundice, liability of temperature or hypothermia, loss of body mass, hormonal or sexual crisis. Physiological hypothermia, caused by insufficiency of processes of thermoregulation and reduced temperature of the environment, compared with intrauterine temperature. The temperature below 36.5 degrees Celsius means hypothermia, above 37.5 hyperthermia. Physiological erythema or peeling, reddish-blue coloration of the skin, inherent in the vast majority of newborns. Maximum expressed on first-second days after birth, passes by 3-5 days, ends with large-scale peeling. Is a paradoxical reaction to the cold when the vessels of the skin dilate and we can see red skin. Physiological weight loss. It is observed in the first days and should be not more than 10% of the original. And its recovery takes up to 15 days maximum. Pathogenesis is connected with the feeling of hunger, liquid loss, and perspiration. For control, we use wet diaper test, normal diet regimen, and waiting. Physiological jaundice observed in 60% of full-term and 80% of preterm newborns. Physiological jaundice is appearance of visible icteric staining of the skin, sclera, or mucous membranes due to an increase in total bilirubin in serum, but not more than 205 millimole per liter after 36 hours of life in full-term newborns and 190 millimole per liter in preterm newborns. The more common jaundice, the higher the level of bilirubin in the blood. These correlations help to suspect high bilirubin levels and do additional tests. Hormonal or sexual crisis is determined by mother's estrogen influence. Its features: mammary gland swelling or physiological mastopathy. Starts on the third, fourth day of life, reaches its maximum on the seventh, eighth day. At first gray, then white contents come out of mammary gland. This process is found among girls and boys. Edema of external genitalia also take place. Desquamatory vulvovaginitis. Significant mucus secretion of gray-white color from the girl's pudendal fissure. Milias. White-yellow dots from 1 to 2 mm in size, often located on nose wings and nose bridge, on forehead and chin. They are oil glands with significant secretion and corked output duct. At this picture you can see the example of milies, clogging the ducts of sebaceous glands due to activity of mother's hormones. So let's summarize, dear colleagues. Adaptation of the newborn to new living conditions is carrying out in physiological status, such as physiological erythema and peeling, physiological jaundice, lability of temperature, mass loss, hormonal or sexual crisis. These conditions disappeared without any treatment. But borderline conditions of newborns required the implementation of preventive measures. Borderline conditions are transient fever, toxic erythema, kidneys uric acid infarct. Transient fever is increase of body temperature of newborn to 38–39.5 Celsius degree. To help baby, we have to eliminate the defects of care, like overheating, dehydration, and so on. Some of newborns have toxic erythema, the appearance of polymorphic erythematosis spots against the background of general erythema, in the center of which appears papules or vesicles. It's the inflammatory skin reaction in response to microbial colonization at birth. How to help newborns with toxic erythema? They need air bath, bathing, additional drinking, special diet for breastfeeding mom. In severe conditions, we use anti-allergic drugs. Air bath is also a very good method of hardening. Kidneys uric acid infarct. This condition frightens parents the most because it is manifested by red spots of urine, similar to blood. It's the deposition of uric acid in the form of crystals in the cavities of the collecting tubes of the kidneys. To help for newborn with the urinary renal infarction, we have to increase the amount of drinking water. So, borderline conditions like transient fever, toxic erythema, kidneys uric acid infarct do not require treatment but needs change in child care and some preventive measures. Pathology of the neonatal period can be obtained before birth, like embryopathy and phytopathy, during childbirth, like traumas, and after birth. At this picture you can see some examples of embryopathy, most root pathology. Non-overgrown lip or hair lip, cleft palate or wolf's mouth, lack of limbs or defect of the anterior abdominal wall. Phytopathy is not so severe and is manifested by fibrosis, cirrhosis, hypertrophy. One of the examples is congenital crooked neck. In the left side, you can see the baby with the diabetic phytopathy. Baby with big body mass born to a mother with diabetes. Cephalohematoma is one of the most common injuries. This is an accumulation of blood under the periosteum. Often during childbirth, especially in large fetuses, a clavicle fracture occurs. On the left, you can see fracture on the X-ray. Obstetric paralysis is a damage to the shoulder plexus that occurs during childbirth, characterized by a disturbance in the mobility and sensitivity in the upper extremity. Among postnatal pathology, the most common are respiratory distress syndrome and propensity to septic conditions. Respiratory distress syndrome, or hyaline membrane disease, is severe breathing disorder in preterm infants due to lung immaturity and primary deficiency of surfactant. Neonatal sepsis is a clinical sign of infection and a systemic response to it, like tachycardia, more than 160 beats per minute, tachypnea, more than 60 per 1 minute, hypothermia, more than 38 Celsius degree, hypothermia, less than 36 Celsius degree, marked changes in the white blood type of systemic syndrome inflammatory response. Newborn's Omfilat is an inflammatory process of the umbilical wound, is a common cause of sepsis. Dear colleagues, we have completed discussion of the peculiarities of the neonatal period, with its physiological processes, borderline processes, and most common pathological processes and diseases. Thank you for your attention.